Community Analysis Presentation, Clermont, Florida, by Maria Catalina de Valdenebro. The city of Clermont is located in Lake County, 23 miles west of Orlando and 59 miles northeast of Tampa. It was founded in 1884. In 1891, the city was incorporated as town of Clermont, Lake County. Many years later, the city of Clermont became known as the Gem of the Hills because of its beautiful homes with well-kept lawn and paved streets, its gorgeous lakes and fantastic views. Obviously, one of the most beautiful places in the state. During the 20th century, the citrus industry flourished in Clermont before freezes and citrus canker forced growers to move farther south. Disney World came to Florida and the land value in Clermont skyrocketed. Citrus growers benefited from paving the way for developers. The city of Clermont is now full of subdivisions, apartment complexes, houses, and retail stores. The city of Clermont and its community structure will be compared with the city of Ocoee, Florida, due to the similarity in population size of these two communities. The city of Clermont meets the community needs by providing housing, recreation areas, places of worship of different denominations, education, health and health promotion, and lastly, transportation. In the city of Clermont, as well as in the city of Ocoee, there are plenty of apartments, houses, and even shelters for its citizens and citizens in need. There are also many recreational areas and parks in the city of Clermont and in the city of Ocoee that are accessible to its citizens. The city of Clermont, as well as the city of Ocoee, has multiple religions in its community, such as Catholic, Baptist, Assembly of God, and non-denominational, with their respective places of worship. Lastly, both communities offer a variety of education settings, which include private schools, public schools, and a state college. The city of Clermont has one community hospital, South Lake Hospital, as does the city of Ocoee. Both community hospitals belong to the same organization, Orlando Health. Both communities have multiple gyms, like the National Training Center in Clermont, that belongs to South Lake Hospital. Both communities also offer multiple health promotion activities to its citizens. The city of Clermont offers swimming, tennis, and golf lessons, and it also has an adult softball and basketball league, among other activities offered to the community. In the same way, the city of Ocoee offers swimming and dancing lessons, and it has an adult kickball and softball team. Both communities have seen an increase in their population causing major road renovations and enlargements. Clermont, Florida has seen a huge population growth in the last couple of years. In 2010, the population was 28,742, which was 207 and 96% more than in 2000. The population growth rate in Clermont is much higher than the state's. The state's growth average is 17.64%, and it also is much higher than the national average growth rate of 9.71%. The population density in Clermont is 1,813 people per square mile, which is much higher than the state average density of 285 and 92 people per square mile, and again much higher than the national average density of 81.32 people per square mile. The predominant race in Clermont is white, which accounts for 71.69% of the total population. The average education level in Clermont, Florida is higher than the state and national average. When comparing the city of Clermont and the city of Ocoee, both communities had three similar areas of health concerns: heart disease, sexually transmitted diseases, and cancer. Sexually transmitted diseases have been in the rise for both communities, mainly chlamydia, placing both communities above the national average of 174.82 cases per 100,000. City of Clermont, located in Lake County, has 295 cases per 100,000 of population, and the city of Ocoee, located in Orange County, has 532 cases per 100,000 of population. Heart disease and cancer are among the top leading causes of death in Florida and in the country. Given these numbers, the community needs more sexually transmitted disease prevention education. Also, more vascular health teaching, especially when there are other factors involved like obesity, and more cancer screening, education, and awareness. In relation to access, acceptability, and affordability, the City of Clermont has three main health-related options for the community. South Lake Hospital is a community hospital. It provides multiple services such as emergency room services, cardiac catheterization, orthopedic, diagnostic imaging, labor and delivery, among others. South Lake Hospital accepts anyone that comes through its doors needing assistance. However, the hospital bills for services provided. The Florida Department of Health provides services ranging from STD treatment to family planning, pregnancy care, dental, and immunizations. South Lake Health Clinic also provides primary care services and dental. The last two mentioned offer services for people of the community who are uninsured, unemployed, or have less economic resources. As previously stated, the City of Clermont and Lake County have seen an increase in sexually transmitted diseases. More specific, an increase in chlamydia. Sadly, the part of the community most vulnerable to this issue are the teenagers and young adults that are experimenting and are less educated about the facts of STDs and its prevention. Also, the fact that cancer and heart disease are two of the major leading causes of death, not only at a national level but also at a county and city level, are the rationale for choosing these three objectives. The City of Clermont has adequate environmental resources related to sanitation, water services, and wastewater collection and treatment. The sanitation services are provided to approximately 11,000 Clermont citizens by removing garbage, picking up recycling material, and removing yard waste. The City of Clermont provides approximately 190 million gallons of water to its citizens each month. One remarkable aspect of the water service the city provides is that for the third year in a row, the City of Clermont's East Water System received the Florida Department of Environmental Protection's Plant Operations Excellence Award due to its amazing water treatment plant operations, compliance, and maintenance. The environmental resources used for the water service is the Florida Aquifer that is replenished by rainwater. The wastewater treatment plant is capable of handling 4 million gallons per day. After going through a biological and chemical treatment, the wastewater leaves the plant environmentally friendly and ready to be used in irrigation system and golf courses around the city. The Department of Public Resources is responsible for multiple different functions such as county libraries, agricultural education, and parks. The Agricultural Education Services Division helps improve the quality of life of the community. It protects and maintains environmental resources. The Library Service Division plans and coordinates library development in the community. Parks and Trails maintains parks and recreational facilities for the community and its visitors by protecting and enhancing the environmental resources found in the area. All the previous mentioned are another way to show the adequate use of environmental resources in the community. One of the major environmental concerns in the community is the implementation of a new curbside garbage collection system that was put into place October 6, 2014. The new service offers residents a 1-1-1 curbside collection program, which involves a once per week trash, once per week recycling, and once per week yard waste collection service. The new program also provides residents with 2 trash cards, one for trash and one for recycling. This is a change from the previous garbage collection program that was in place, where the residents provided their own trash cans and the garbage collection was done twice a week. During multiple interviews to random Clermont citizens about the subject, the conclusion was that the community is upset at this new unnecessary program, not only because they have to store their trash for longer periods of time, but because it comes with a price. For the residents of Clermont, the new program comes with a price tag of $189 annual fee for collection and disposal fees. The public officials in the city of Clermont are readily available to the community and their concerns, or the public meetings dates are listed on the Clermont official webpage for the community to see, and everyone is welcome to participate in the meetings. Also, all the minutes from all meetings are on the webpage as well for the community to review and be able to see the previous issues that have been addressed. Two major issues of concern in the community are public transportation and community development. As part of budget cutting, Lake County commissioners decided to end service for 2 bus routes, leaving citizens in the Clermont area without dependable public transportation. Lake County has been sponsoring both links routes with local tax money, but the county has decreased its budget due to the failing economy. Reasons why Lake County is sending the funding for the route Link 55 and Link 204. These cuts represent a $70,000 saving for the Lake County officials and their budget, but it's a huge loss for the people of the community that relies on public transportation for their everyday needs. Even though the city of Clermont is in the process of dealing with the community development issue, it is an issue that is long overdue. The city needs a bigger and better direction and a plan that enhances the city and its surroundings. Currently, there is a plan that will be divided in 6 phases that will give downtown Clermont the facelift that it so desperately needs. The city of Clermont has 6 community needs for its improvement. The first one is the need for heart disease education and prevention among its citizens, since it has been on the rise and is among the leading causes of death. Cancer is another health issue that has been on the rise in the community and is also among the leading causes of death. By promoting cancer screenings, the possibility of catching the disease on time increases, which in turn helps the community to get prompt treatment, increasing the possibility of survival and remission of the disease. STDs are in the rise not only at a national level but at community level as well. Providing education to the community is the best way to accomplish prevention and spread of STDs. The city of Clermont is a community that grows each day more and more. In 2013, the city had a population of 30,033 people. For a community this size, the fact that there are only 35 police officers in the city and 3 fire stations is absurd. The city is growing, and the police and fire department should reflect that, to be able to provide the services needed in the community for its citizens to feel safe and protected. On the same note, as the community grows, the public transportation gets called. Also not good for a growing community with the potential to continue growing. The community officials need to be able to provide the community the necessary tools to be able to have a prosperous life, and that include transportation that the community can use to go to school, to go to work, etc. Lastly, the development of the community is a representation of what the community has become over the years and how it has evolved. By developing and modernizing the city of Clermont's downtown area, the city enters a new era, providing new opportunities to its residents and the community. Cancer screening programs in Australia help protect the community's health through early detection, even when there are no signs and symptoms of the disease. Screening focuses on finding early signs of cancer before it develops and before any symptoms arise. The program include Breast Screen Australia, National Bowel Screening Program, National Cervical Screening Program. Spot Me Free Skin Cancer Screening is a program found all over the United States. Its main focus is to reduce the number of deaths caused by skin cancer by educating the community about skin cancer risk and providing free screening to catch the disease in its earliest and most treatable stages. As a community health nurse, the best intervention is by practicing the 3 stages of prevention. Primary prevention is done by providing routine cancer screenings in the community. Secondary prevention is done by contacting the known cancer patients that are in remission or those at risk of developing cancer and providing further screening for metastasis. Finally, tertiary prevention is by helping those people in the community that are receiving cancer treatment like chemotherapy and radiotherapy to recover and rehabilitate.